Good morning. I am really excited to be here, and I am even more excited that you folks are here learning to be change makers, because you folks are the ones who are going to transform primary care. So it's very, very exciting. I am the Director of Leadership Development at Primary Care Progress. I have been a healthcare consultant for the last 25 years. My kids always say, so what does that mean? They think when they were little, they thought I spent all my time in hotels. I did, but there was some work that went along with it. Essentially, what I do is work with healthcare leaders, both administrative leaders and clinical leaders, to get the results they want, and to do it in a way that they want to work together again. So sometimes that looks like executive coaching. Sometimes that looks like working with a senior team to help people work together. So I didn't always work in healthcare. In fact, the first 12 years of my career, I was a computer geek. I spoke binary and hex more than I spoke English. My form of entertainment was to analyze a core memory dump after it crashed. I carried around my boxes of core dumps for 15 years before I actually parted with them. Toward the end of my career in high tech, I was tapped to be part of a dream team. Out of 34,000, 21 of us were chosen to be on this team. You would have thought that that was the opportunity of a lifetime. I'll tell you how it turned out in a minute. We had a very tight timeline. We had a year to get the product done. We had never worked together before. The leadership chose not to have a formal leader. Their first mistake was to say, leaders will emerge out of the team. You don't do that with a competitive group of people with an EIQ of about 2. It turned out to actually be a nightmare experience. It was cutthroat. We didn't know how to handle conflict. Every day I went in feeling like I had to get in touch with my inner warrior woman. Just to give you a couple of examples, I remember one time sitting in the meeting and saying out loud I wasn't quite sure what to do. And Nick, my teammate across the table, 30 years later, I still can see Nick. He just looked at me and said, well, maybe you don't deserve to be here. There are a lot of people who would like your seat. And it didn't end there. The leadership of this, we all dreaded progress meetings with the senior team, but it was the only time I was glad that I was not a woman. Back then, the protocol was that guys had to wear ties. If the VP didn't like what you said, he cut off your tie. And you couldn't take it off. You had to wear it. So it was like, great, at least my uniform didn't include a tie. A year later, the product was launched. It was hailed a huge success, and I was dumbfounded because 17 of the 21 left the company shortly after launch. I was one of the walking wounded. I got it. The product was successful. As far as I was concerned, the project was a failure. It had nothing to do with how smart we were. It had everything to do with our ability to work together. We were taught how to analyze bits and bytes. We were not taught how to work together in a team. So I made a career shift. I said, I've got to go out back to school, and I got to figure out this team stuff. And that's what I have spent the last 25 years of my life doing. My transition into healthcare came while I was back in graduate school. Quality was just coming to healthcare. Quality had been a long time in computer manufacturing. I was a techie who could talk. Around that time, I had my second child, and she was ill. Spent a lot of time in these Boston hospitals, and I saw firsthand the consequence of smart people not working together. So since then, I have been on a mission. True confessions, I have been a closet relational leadership consultant, probably for about 20 years. Fast forward maybe 10 years ago, I got introduced to this place called the South Central Foundation. Has anybody heard of SCF? If you have not heard of it, Google it. It is an incredible, incredible place. Don Berwick has basically said this is the delivery, they've invented the delivery system for primary care for the future. I'd consulted with them on and off, and every time I went there, something was different. These people talked about relationships. They actually built their primary care from the ground up around patients. They don't even call them patients, they call them customer owners. Everybody who goes there, doesn't matter whether you're a janitor, a researcher, or a doctor, you go through 3 days of relationship training. So these people got it. I felt like I had to go, I don't know how many miles is Alaska from here. That's how far I had to go to get out of the closet about the importance of relational leadership. I had a fabulous laboratory. I was embedded with the teams. And I could tell after a while which integrated care teams were going to be successful and which weren't. And guess what? How I could tell? Just by watching. Anybody? The successful teams talked together all day long. The others didn't. They were still had the mindset of being in service of the provider. And in many cases, the nurse case manager knew more about the patient than the provider did. So over time, working with the clinicians at SCF, they kept coming to me one by one, saying how important this work was to them. Not even professionally, personally. They said it made a difference in their lives with their families, sometimes with tears in their eyes. They told me that it helped them be a better clinician. And last to come was it made them better team members and team leaders. The other thing that they told me is, I wish I knew this stuff 20 years ago. They had to unlearn a lot of stuff. So when my time with SCF ended, coming back to New England, I was, okay, do I go back into independent practice, pick up where I left off, or do I do something different? So I decided 2 things. One is I needed to work with trainees, that now I'm on a mission and I am out of the closet because all my SCF folks told me I had to get out of the closet and bring this stuff to the world. I discovered PCP, met with Andrew, and the rest is history. So it's part of why I'm really excited for you folks to be here. You're doing important work, and you can't do it alone. Okay, today we are going to get, or this morning anyway, we are going to get practical. Yesterday you learned that you couldn't do this work alone. So you've gone out, you've recruited a great team, you've collected all these wonderful tools, you are ready to go home and rock. What is one of the first things that you're going to do? Have a meeting, yes. You are going to convene the rest of your team and hopefully start working on a goal. So it's important, though, that you engage people, not just for one meeting, but for the long haul. People will not stay engaged if they don't feel that their voice is heard, that their opinions are respected and valued. So learning how to run an effective meeting is really important. And guess what? That's not something that they teach you in your clinical training. So what we're going to try to do is a threefer this morning. We are actually going to provide you with a template that you can use to go back and run a goal-setting meeting. You can use it as is or modify it as you want. We're going to introduce you to the fundamentals of meeting management. If folks want to follow along in their guide, it starts on page 52. And you are going to get to dip your toe in the water of meeting facilitation. So, whoops, I want you to start out thinking of one of two meetings that you have participated in. It can either be a Scream meeting or a Dream meeting. I don't care which one it is. I just want you to have a vivid picture of that meeting. I want you to recall what it felt like to be part of that meeting. So I'll give you a few seconds to think. So now I want you to pull out a piece of, oh no, this was the right one. I want you to pull out a piece of paper. And I want you to think about what made it either a Dream meeting or a Scream meeting. What were the factors that contributed? What happened or didn't happen to make it either a Scream meeting or a Dream meeting? So I want you to get down at least a couple of ideas. And when you put your pen down and look up, I'll know you're done. Okay, for whom did a Scream meeting come to mind? Raise your hand, be proud. Okay, what were some of the factors that made it a Scream meeting? Can just go around. Spencer, just one of the factors. Okay, there was no participation and decreased attendance. Maybe I can have some runners. Who else? Dana, you had a Scream meeting?
Not being able to get through all the agenda items and running out of time.
So a laundry list of agenda items running out of time. Who else had a Scream meeting? Go ahead.
Participants were bored and on their phones.
Participants were bored and on their phones. I love that when you go into a meeting and all the laptops come up and everybody says they're paying attention. Yep. Let's hear a couple of others.
From my experience, they would not agree to a subject. They'll just keep going on and on and on and on, not agree, teamwork.
Okay. So I call that like serial advocacy. Everybody's fighting for what they think is the right answer. Go ahead.
Right people aren't in the room. Either more people are in the room than we or the right people.
Right people are not in the room. Great. Let's get just a couple of more.
No plan for follow-up.
No plan for follow-up. One more. Anybody? Go ahead.
Like negative people?
Negative people. Yes. Yes. Every idea sucks but theirs. Yep. Been in that meeting. Who had Dream Team experiences? Raise those hands. Okay, let's hear about what made it a Dream Team.
Active listening amongst participants.
Active listening amongst participants. Let's get some others. Okay, keep your hands up so we'll know. Go ahead.
Well, there's a facilitator, someone in charge, and someone in charge of setting an outline of what we're going to talk about in the meeting.
Great. Someone was facilitating, someone had a plan. Go ahead.
Everyone had an opportunity to talk.
Everyone had an opportunity to talk.
Oh, there was a clear process for making decisions.
There was a clear decision-making process. I'm impressed that so many people have been in good meetings. There's one person back there.
We left knowing what our next steps were.
You left knowing what next steps were and hopefully who was responsible for them. Let's get just a couple more. Go ahead right here, Victoria. Food, yes. Yes, snaps for food. One more.
Passion.
Passion.
When someone's...
People cared. Let's get this one. Go ahead.
It ended on time.
It ended on time. Excellent. So, we got to get back. So the purpose of this is to make sure that you end up on the Dream meeting list and not on the Scream meeting list. So when you think about facilitating and what it is, there are actually two parts to it. There is the what and there is the how. Most of us are familiar with the what. It's the reason you're meeting. It's the outcome that you're looking for. It's the goals, it's the problem that you want to solve. It's the what. The how, we often don't know about because you don't see it. We're not taught about it. But it's really thinking through things like who said there was a clear decision-making process that we used, how relationships are maintained. The data is very clear that the teams that have the most potential to be high-performing are the most diverse. And there's a caveat, because when you have diversity, you have conflict. If folks are not comfortable managing conflict, it ends up to be my high-tech team, where you had a bunch of brilliant people who didn't know how to work together. What are the tools that you're going to be using? We talked about what are the rules, what are the ground rules, our rules of engagement, what are our norms? What are the group dynamics? Is it boring? Is everybody on their iPads or their iPhones? Are people engaged? Is there passion? Has it disappeared? What's the vibe in the room? What's the vibe that you want to have? I once had a participant in class who said that facilitation was a little bit like being a pilot. Does anybody here fly? I don't. But what he said is the way that you know that you're on course is by being off course. So you are always, always watching. And that's what a good facilitator does. They always watch the balance between focusing on the what and the how. I still do a little bit of consulting, and just 2 weeks ago, I worked with a very large academic medical center with the executive team. They were in trouble. They were being led by a fabulous physician. 2.5-hour meetings were task updates. Everybody just went around the room and reported to the CEO. They were frustrated. He was frustrated. He was spending too much focus on the task. What I helped them do was redesign their meetings so that they were more inclusive, more discussion. You can't be too far on the process side, though, because then you have a great time and nothing gets done. So it's the role of the facilitator to keep your eye on the dial as you go through. Any questions on that? Comments? So I like to know about, my techie side comes out. Tell me what the exact skills and abilities are that I need to be a good facilitator. So I want to share those with you. And we've divided them into 3 buckets. There are things that you do before a meeting, there are things you do during the meeting, and there are things that you do after the meeting. So when we start with before, somebody talked about this. There was a facilitator. In your chapter leadership team, decide how meetings are going to be facilitated. Is one person going to do it all the time? Are you going to rotate it from meeting to meeting? Are you going to share that responsibility within a meeting? Start with the end in mind, and you build your agenda from there. When you walk out of that meeting, what will have made it a success? Because the outcome is what determines how you build your agenda and what the process is that you use to facilitate that meeting. There are things that you do during. Identify roles. Who's the facilitator? Who's a scribe, the note keeper? Who is the timekeeper? What are our norms? If you've defined them once, it's important to review them at the start. If you haven't created them, do it. How are you going to manage participation? Somebody else mentioned on the Scream meeting that not everybody got to participate. So how are you going to manage this meeting to ensure that everybody has a voice? There's always somebody that wants to take you off on a tangent. I refer to it as going down a bunny hole. The way to manage that is to have a parking lot. It's a piece of flip chart paper that says parking lot, and you park all those bunny hole ideas or thoughts. Make periodic process checks. How are we doing? Are we going too slow? Are we going too fast? Is the process we designed working? You summarize the discussion. So I think we have 3 themes, A, B, and C. Have I got that right? Make sure that meeting notes are taken. You're all busy. Not every chapter leader is going to be able to attend every meeting. You want to make sure that they have a way to stay plugged in. And if you're like me, you can't remember tomorrow what you agreed to today. So it's important to determine who's going to do what by when. So after the meeting, a couple of things. Continuous improvement, a simple plus delta. What worked? What should we do differently for the next time? And make sure you share those meeting notes, in part so you can remember what you signed up for, but again, it's an important way to keep folks engaged. Now, in your book on page 56, there's a little self-assessment. I'm going to have you take it. You can be honest. Nobody's going to collect this. It's just you. I'm going to have you stand up and move away from the chairs. I'm going to have you stand up and for 5 minutes talk with somebody you don't know about your results. Okay, everybody up. Find a new friend. Okay. So just quickly, I want to hear a few of the skills that folks are going to work on. So just shout them out. Is it Andrew?
Working on how to be a good facilitator.
Okay, excellent. Let's come over here. Nash.
Evaluating the meeting.
Evaluating the meeting. Let's get a couple from the back. Anybody? Red shirt. I can't see your name, but I love red. The fellow who just turned around, that's you.
Probably the biggest one is the norms.
Oh, okay, great. Just get 2 more. Detailed agenda. Anybody else? 1 more.
Staying on time.
Staying on time. All great ideas. So I wanted to end this just by kind of putting it all together. We have some folks who volunteered to demonstrate a meeting for us. So folks, want to come on? Woo! So they're going to put it all together for us.
Hey guys, how's it going?
Yeah, it's going.
Yeah?
Hello? Yeah, it's going.
Oh, what's the matter?
You know, it's just been a long day. I just have a lot of stuff to do, and then this meeting just comes out of nowhere. So, I mean, I might have to run out in like 5 minutes, but, you know, do your thing, and then we'll go from there. So.
Okay, I mean, I don't want you to feel any pressure. If you have to go, you should just go whenever you need.
Yeah, maybe like 7 minutes.
Okay, okay. Take care of yourself, whatever you need to do. How are you doing, Jeanette?
Oh, I'm good. I prepared some proposals for what we're supposed to do, this campaign about raising $10,000 for hunger, and I figured it all out. I have a Kickstarter campaign, I have the
sorry.
Oh, hi, Kathy.
Oh my God. My cat just had this huge disaster.
What happened?
I don't know.
Wait,
so here's the proposal, and I think in a week we can probably get this thing up and running.
Oh.
No, this is, look, I've already written it, and I've created the categories.
Wait, Steph, did you
Steph?
Hey, Steph.
Yeah,
This is
what's
last
up?
year. We didn't talk about doing last year.
No, guys, I have it worked out. I've already written it up. By next week, we're gonna have 10 grand for this campaign. Will be done.
So, because I was thinking that we could redo the last
done.
Like Kathy, remember last week when we were mentioning?
No, it sounds like everyone.
Cut! This is a screening meeting. We need the meeting fairy. Quick, throw some fairy meeting dust.
Again?
Take 2.
Don't we start? Oh, okay. Hey, Lauren and Jeanette. I'm really glad we could meet today to talk about our plan for fighting hunger.
Thanks for having us.
Yeah, oh my God, of course. Kathy's coming. I'm not sure what's going on, but we should probably just go ahead and get started.
Sure, yeah.
Anyway, oh, hi.
Hi, I'm so sorry.
Great.
I just had an emergency. I'm going to turn off my phone
Oh,
and
great.
I promise I won't
Okay.
do anything until we're done.
Sounds good.
Hey, Steph.
Yeah.
I might have to run out in like 15 minutes or so, but I'll try and get as much done as I can
You
here.
know, since you emailed me that yesterday, that's already planned. So
Okay,
it's on,
great,
you
yeah.
can see, here's
I just wanted
the agenda.
to remind you.
No, thank
Yeah,
you. Thank you.
Okay.
And also, Steph, I just wanted to say that I've already created a proposal for our campaign,
Oh,
and
great.
we
Oh,
started it.
Okay,
can-
so Jeanette, I'm really glad you started brainstorming ideas. In just a second, we're just gonna go around, do some intros. Not everybody knows each other. Then we're gonna start talking about ideas, so that's a great idea. Please bring that up when we start mentioning ideas, but we're gonna spend this meeting really brainstorming.
Okay.
Great. So let's start with introductions. If you wanna go around, say your name and your favorite vegetable.
Hi, my name's Lauren. I love kale.
I'm Jeanette, and broccoli?
I'm Steph. I like corn.
I'm Kathy. I like tomatoes, although they might be a fruit.
They are
That
fruit.
counts. That's
Yeah.
okay.
Yeah.
All right, so let's start brainstorming. So we're gonna go around the room and everybody share one idea, and the point of this is just to brainstorm. We're gonna get as many ideas as we can. Kathy, would you mind scribing for us?
Sure, no problem.
Great, thanks.
Cut! You have just experienced a dream meeting in the making. Okay. I am going to just give you a very quick framework. We want this to be really practical. You can use this for 80% of your meetings. I've been a professional facilitator for 25 years. Guess what? This serves me well 75 to 80% of the time. First, you want to make sure everybody understands the problem or the challenge, the reason that you're there. This is probably the most overlooked step. People think it's perfectly clear, and it's not. If you go around the room, ask people what problem they think they're solving, chances are everybody's got a slightly different answer. Multiple realities. Next, you're going to do what our dream team did. You want to generate ideas. You want to open it up. It requires divergent thinking. You need to defer judgment, strive for quantity, seek wild options. I'll give you an example. LL Bean, anybody heard of LL Bean? They do free shipping. It was getting expensive. They needed to reduce the cost. They had a problem-solving session. Somebody said, I wish packaging was as tight as a rock star's clothes. Guess what that turned into? Shrink wrap. Now we shrink wrap everything. So the wilder, the better. You want to combine and build on ideas. Once you've got all these amazing, amazing ideas, at some point you got to start to narrow down and select. That requires a different type of thinking, convergent thinking. You've got to be deliberate. You've got to check against the criteria that you said you wanted your ideas, whatever solution to meet. This is the place where you improve the idea. If it doesn't quite seem feasible, keep playing around with it. But you've got to be affirmative to start. I think of it as a funnel, that the final selection has to come out of the funnel. And finally, you've got a plan of action. If you do these 4 things in a meeting, you're well on your way to a dream meeting. When you go to your breakout group, you're going to learn specific tools for generating ideas and for narrowing down, for selecting ideas. So, you are about to go to your breakout groups. You are going to sample that goal-setting meeting. You're going to experience a mock goal-setting meeting, and you're going to get a chance to facilitate. What I want to encourage you to do is facilitate boldly and hold your performance lightly. This is a dip the toe in the facilitating tank. So, go ahead to your breakout groups.